Good morning. This is self-promotion plan presentation from Anna Paula Liston, class fpx4060. Practical and Community Improved Population Health from Capella University. We are talking about SIDS. So, what is a sudden infant death? Sudden infant death syndrome, aka as a SID, is one unexplained death, usually during sleep, of a seemingly healthy baby less than a year old. SID is sometimes known as a crib death because the infant often die in their cribs. Experts believe SIDS occur at a particular stage of the baby development and it affects babies vulnerable to certain environmental stress. This vulnerability may be caused by being born prematurely or a low birth weight or because of other reasons that have not been identified yet. In 2019, approximately 3,600 sudden unexpected infant deaths occurred in the United States, while 42% of these deaths were due to sudden infant death syndrome (SIDS). 24% result from accidental suffocation and strangulation in bed, and 34% were classified as unknown. Environment stress could include tobacco smoke, getting tangled in bed, and minor illness or breathing obstruction. There is also one association between co-sleeping, sleeping with your baby on bed, sofa, or chair, and SIDS. Babies who die of SIDS are thought to have a problem in the way they respond to this stress and how they regulate their heart rate, breathing, and temperature. Although the case of SIDS is not fully understood, there are a number of things you can do to reduce the risk. Research shows parents can decrease the risk of SIDS and other sleep-related infant deaths by doing the following: placing your baby on his or her back for all sleeping times, naps, and at night. Use a firm, flat surface covered by fitted sheet. Keep your baby's sleep area, for example, in a crib or bassinet, in the same room where you sleep until your baby is 1 year old. Keep soft bedding, blankets and pillows and bumper pads and soft toys out of the baby sleep area. Do not cover your baby head or allow your baby to get too hot. Signs your baby may getting too hot include sweating, though his or her chest will feel hot. About 3,400 in the United States die of sudden and unexpectedly each year. This statistic may sound alarming, but SIDS is rare, and the risk of your baby dying from it is low. SIDS usually occurs when your baby is asleep, although it can occasionally happen while they are awake. Most deaths happen during the first 6 months of your baby life. Infants born prematurely or low birth weight are the greatest risk. SIDS also tends to be slightly more common in baby boys. Parents can reduce the risk of SIDS by not smoking while pregnant or after the baby is born and always placing the baby on their back when they sleep. The proper sleep management use a proper heating system for the child and making sure that the body temperature of the child do not go above 37 degrees. Follow the proper vaccination strategies and the child development immunity in the early stage. Sudden child death in children occurs when the child already have a problem by the birth. They have several abnormalities in their body, specifically in the brain part. External appearance can be normal to postmortem or rigors. We get the report pulmonary congestion, edema, intrathoracic petechiae. Petechiae is a pinpoint spots that appear on the skin as results of the bleeding. It's like a pressure bleeding. Occurs 90% of the situation. Also, trachea irritates and stomach contents found in the trachea. Anthropological studies of the parent-infant shared sleeping have found sleeping with an infant to be associated with improved settings, which reduce crying, improvement maternal and sleep, infant sleep, and increase arousal increase during the breastfeeding, and reduce formula supplementation. Support for the beneficial effect of shared sleep environment is also provided in studies of the physiology of the mother-infant contact. Studies of the skin-to-skin contact, the kangaroo care among the preterm and the newborn infants have documented the benefits of continued infant-mother contact, including improved cardiorespiratory stability, oxygenation, and thermoregulation. Longer periods of the infant sleep and more restful sleep reduce crying and enhance milk production, along with more successful, frequent, and longer duration of the breastfeeding. Breastfeeding is universally recognizing as the optimal way to feed the infant due to the numerous health benefits for both infant and their mothers. In USA, breastfeeding initiates rates are high, 96%, although only 39% of the infants exclusive breastfeeding to third month of age, and the figure falling to 15% by around 6 months. Breastfeeding and sharing a sleep surface constitute an integrated care system which mutually reinforcing. Breastfeeding promotes shared sleep, which increases breastfeeding frequency and extends duration of breastfeeding by months. Sustaining skin-to-skin contact between mother and infant in the first 24 hours post-birth is critical to establishing optimal breastfeeding. There is also a strong association between breastfeeding and infant sleep partner, with breastfeed infants exhibiting night awakening behavior that is necessary for both for nourishment and ongoing stimulation of the breast milk in the mother. Well, thank you for watching this video.